Good day to everyone. I am Nicole Angelus Aranda, and today I'm going to take the blood pressure. But before taking the blood pressure, make sure to assess several factors. First, like for example, clinical signs of hypertension or high blood pressure. It is 140/85 millimeters mercury, and clinical signs of hypotension or low blood pressure, and factors that may alter the blood pressure result. And next is if the client have latex allergies. So after that assessment is assemble all the equipments needed. So we have here our stethoscope used for auscultation, alcohol and a wet ball, cotton ball, and sphygmomanometer with blood pressure graph, and of course we have here our paper and a ball pen for us to take down the result and for documentation. So after assembling all the equipments, proceed to your client, introduce who you are, identify the client's identity, explain what you are going to do, why is it necessary, and how the client can cooperate. Make sure also to ask the factors that may alter the blood pressure results. Good day, sir. I'm your nurse for today. I'm Nurse Nicole Aranda, and today I'm going to get your blood pressure. Is that okay with you, sir?
Yes, ma'am.
So, sir, may I just know if, what's your name?
My name is Nico Jan B. Pinalgan.
Nico Jan B. Pinalgan, sir.
Yes, ma'am.
Okay. Sir, may I just know if you have latex cough allergies?
Nothing, ma'am.
Okay, sir. How about, sir, do you feel any dizziness or pain on your nape?
No, ma'am.
How about, sir, dehydration or there is unusual thirst?
Nothing, ma'am.
How about, sir, chest pain, difficulty of breathing, like that, sir?
Nothing, ma'am.
Okay. Sir, pumunta ka ba dito na naglakad, sir?
Yes, ma'am.
Sir, do you feel relaxed right now?
No, ma'am.
Okay, sir. If that's the case, sir, I'm giving you 10 to 15 minutes for you to rest and to relax.
Okay, ma'am.
Okay, sir?
Thank you.
And next is to perform the hand hygiene procedure and other infection control procedures. So for me, I just did my hand washing, and now I'm going to add alcohol or any antiseptic materials can do. So rub firmly, and then provide for client's privacy. In providing the client's privacy, close windows or any curtains, and ask permission when you are going to touch the body of your patient and you are going to expose some of his body parts. So sir, in this procedure, blood pressure taking, I'm going to expose your upper arm and I'm going to touch your forearm. Is that okay with you, sir?
Yes, ma'am.
Okay. And then next is to position your client. So in positioning your client, make sure that he is sitting unless otherwise specified, and his feet must be flat on the floor or on the ground, and his arm must be, the palm must be facing up, and the forearm must be supported at the heart level. So we position our client, so feet flat on the floor, palm facing up, and forearm supported at the heart level. Next, after positioning your client, is to get your equipment. So, first thing that we will do is to get our sphygmomanometer with blood pressure cuff and rub evenly on the client's upper arm. And then locate the brachial pulse for the palpatory. So, in wrapping, make sure that it is even. Make sure that it is not too tight and too loose. Okay? So, in checking that, place your one finger or 2 fingers inside the cup. Just. Okay. Okay. And next is, in putting on in wrapping the forearm of the patient, it can be that the lower border of the cuff is above the anti-cubical space, or it is 2.5 centimeters or 1 inch above the anti-cubical space. So next is to locate the brachial pulse. So of course, In this case, he is wearing a sandal, so his forearm is already exposed. But if the client is wearing t-shirts like that, you should expose the forearm. Okay, next is to locate the brachial pulse using your fingertips. So make sure to locate where it is for the palpatory. Okay, so here. Okay. So I just locate the brachial pulse. And next is when you just found the brachial pulse is to close the valve. How to close the valve? Make sure that the valve is, you turn it like that. So you close the valve of the valve. So, and then palpate using your fingertips. Okay. And then pump the cuff. So take note where the pulse stop, the brachial pulse stop. So make sure to take note of that. So I'm gonna pump where I can no longer feel the brachial pulse. So I'm not. So then release the valve, open the valve, and then wait for 1 to 2 minutes before making further measurements. So just wait and deflate the cuff. So we just did is the preliminary palpatory. So next is we are going to use our stethoscope for the auscultation. So in this procedure, make sure that you have your wet cotton balls or any antiseptic wipes you can do, and you may clean your earpiece. So in cleaning your earpiece, make sure that it is from the cleanest to the dirtiest. So here our cleanest part is here to the dirtiest part. Cleanest to the dirtiest part. Okay. Next, after cleaning your stethoscope is make sure that you put this earpiece of your stethoscope in your ear, and make sure that it is freely hanging from your ears down to your diaphragm. And then use your thumb and index finger to hold the bell or the diaphragm. But most are suggested that we use our first 2 fingers here. So I'm going to use my first 2 fingers. But you can use your thumb and index fingers to hold the bell. And then put the bell or the stethoscope bell on the client's brachial pulse. So make sure that you put it in directly on the skin and not to the body, for you to hear clearly the pulse beat. So there. So next is to close the valve. So we close again the valve because we just opened it a while ago, and then pump the cuff and add 30 millimeters mercury to the palpated brachial pulse a while ago. So I'm gonna add 30. So take note of the phases. First phase, second phase, and fourth phase, and fifth phase. And open the valve. Okay. So I just read the result. It's 120 over 80 millimeters mercury but wait for another 1 to 2 minutes before taking further measurements. So, what we do is to just repeat the process that we just did. So, make sure that when you are reading the sphygmomanometer, you are determining or taking note of the phase 1, phase 4, and phase 5. The phase 1 is the systolic pressure and the phase 5 is our diastolic pressure. So, that's it. And next is when opening the valve, make sure that you open the valve or you release the valve or the pressure 2 to 3 millimeters mercury per second. So we just wait for another minute for us to repeat the process. Okay? So before you completely deflate the cup, so we were going to repeat it once again for us to be clear to the result. Okay? Then wear our stethoscope again and just repeat the procedure. So in wearing the stethoscope, make sure that you are facing this part. So it is like that. Okay? For you to hear the pulse beat or the beating of the pulse. So after 1 to 2 minutes of waiting, we recheck the results. Okay, so put it again on the British pulse directly on the skin and close the valve. Make sure to take note again of the phase 1, phase 4, and phase 5. And add, like I said, add 30 millimeters mercury to the palpated brachial pulse. So we start, we inflate it already. So release. Good. Okay. Then deflate the cuff. Then write down the result. So the blood pressure of Sir Nico John, blood pressure is 120 over 80 millimeters mercury. So that's it. Then after taking the blood pressure, acknowledge your client for cooperating. Say thank you for cooperating. And clean your earpieces from the cleanest to the dirtiest. So we start from the cleanest, that is the handle, to the earpiece. So discard the used cotton balls and fix your equipment. So that's it for today. Thank you for watching and for listening. Hope you've learned something.